Hello. Today I'm going to talk about the empty chair technique, which was first used by Gestalt therapists. And Gestalt therapy was developed by Fritz Perls, who believed that human beings are connected to their experience, their memories, and their environments. And one of the goals of this treatment modality is to help people to create awareness within themselves and connection in everyday life. So the empty chair technique is used to help clients engage emotionally, cognitively, behaviorally, and help them to be emotionally present. And I think that we all avoid things that are going to cause us pain and painful memories and experiences. And when we become disconnected from those, there is a lack of integration. And this technique, it really aims toward getting people connected to themselves and to the aspects of themselves that maybe they've disowned a little bit. And I think that we all have parts of ourselves that we kind of shove up in the attic and don't want to think about and don't want to address. And unfortunately, a failure to do that creates emotional conflict and a lack of integration. So I think that the purpose is to integrate those disowned aspects of ourselves. So this therapy, essentially, the clinician has established a empathic rapport and joined with their client, but the idea is that the client sits across from an empty chair and engages with either themselves or someone that they have unresolved conflict with. So in order to fully connect, the client sits in a chair opposite an empty chair, and they create a dialogue, a conversation with the empty chair. So for example, if a patient was traumatized terribly by their mother, and the mother has since passed away, they would engage the mother in the empty chair as though she were really there, and the social worker or client would say to them, imagine that your mother's really sitting in the chair. What do you want to say to her? And the client would then communicate feelings of sadness, anger, disappointment, pain, and may say, you weren't there for me, and I deserve to have a nurturing experience as a little girl. And then they might even change seats and respond on the part of the mother, how they believe that the mother would respond, and then they could change back to themselves and speak to the mother. And in so doing, by really being present in that moment and connecting with those emotions, all the senses, there is the opportunity for new insight into the conflict and to access the physical emotion that goes along with the cognition. And by having a cathartic moment that is deeply emotional, there is the capacity for the release of that pain and the insight into the inner feelings as well as perhaps the feelings of the other person, in this case, the mother, and to become sort of tuned into those aspects of ourselves that we don't explore because they are too painful. So this therapy it's interesting. I think that initially it is embarrassing and uncomfortable and it feels funny, but it certainly is preferable to shoving all of those kinds of painful memories, experiences, feelings into the metaphorical basement or attic and not addressing them. So the purpose is to become connected with the self and integrate those disowned aspects of oneself. I chose to present on combat trauma, and combat trauma lends itself to a lot of disowned aspects and affect isolation. And I think that to a great extent, many of us practice affect isolation and have to perform in our jobs and to be professional and to operate in society in a socially acceptable manner. But it is important that one does not practice affect isolation all the time, because that leads to mental illness and anger and depression and anxiety. This therapy is excellent for trauma. It can be used with any adult who has intact cognition. It can even be used with children for them to have an opportunity to express anger and sadness in an appropriate setting. That being said, I think that the more cognitively advanced you are, the more effective this technique is, because it is a psychoanalytic kind of technique that is insight-driven. So I think that the purpose, and I'm just looking here, I'm going to cheat a little bit and look at my notes. I know that last week one of our classmates did a presentation on connecting immediately to the environment in order to decrease anxiety. And in the empty chair method, there is an emphasis on connecting to sensation and movement and affect in the present. And this technique promotes verbalization, and also something that the Gestalt therapists refer to as emotional flooding. And I think that people in pain have a tendency to shut off from emotion, and so this is a safe environment in which people can flood emotion and have honest and authentic communication with themselves or people that have wronged them or traumatized them. Also, it is not uncommon for people in the empty chair to speak to their younger self and communicate forgiveness or associated feelings like that. So, empty chair is my topic, and I think that it's a very cool and interactive technique that takes the client out of the sort of more passive role. So thank you so much for listening.